The Productive Dentist Academy Podcast Network.
Remember her coming in and feeling so defeated. And he said to her, if you had a really nice car, how often would you wash that car? And she kind of stopped and was like, well, I would probably wash it every week.
Hi, everyone. Welcome back to the Everyday Practices podcast. Today's conversation is one that every dental team needs to hear. We spend so much time talking about treatment plans, but not enough time talking about what patients actually feel in these moments and really how the team shows up. And often the person who sees them first is not the doctor, it's the dental team. So today I am so honored. We are joined by someone who has spent more than 2 decades walking patients through those moments. Sommer Carrol has been with Granbury Dental Center since 1998. Girl, helping patients navigate treatment, smile transformations, and really the emotional side of dentistry that people don't talk about. Sommer, I'm really excited for this conversation. So, welcome to the podcast.
Thank you. Thanks for having me.
Yeah. So, 1998, that is almost 30 years in dentistry.
Yes.
What has changed from when you first started?
So much has changed. I learned everything on the job. When I started in dentistry, I had previously been working at a vet clinic, basically, helping with surgeries, and I was cleaning dogs and cats' teeth. That's about as
Yeah.
close of anything that I knew about dentistry. And so I learned everything on the job. I was trained, by the best, in my opinion. And I got the opportunity to work in different roles. So, started out as a dental assistant. I learned a lot over, I'd worked with one of the associates. Um, and then I was a hygiene coordinator. I was a hygiene assistant. I worked up front for sometimes and would fill in. I did insurance verification. So I've literally kind of walked in a lot of different roles in the dental office, and I feel like that gives me, um, a good idea and understanding of what everyone in the team's roles are.
Yep.
Uh, my preference is to be chair side. That's where I feel like I thrive and where I feel like I can benefit the patients the most.
Yeah.
So that's what I enjoy, is just really walking them through their journey of, where they're at, where they start, and walking them through to get them their confidence back and their self-esteem back. And it's very rewarding. I feel like I don't know how many other industries have such a rewarding career. And we get emotional paychecks when we do our smile reveals, and
Yeah.
that is just it's very special.
It really is. That's something that we've talked to so many practices about over the years is doctors and dental teams. Do you realize you are literally transforming patients' lives every single day, And I think because it's stuff that we do every day, we get, into the, checklist of life, right? And I think sometimes we forget about the power that we really have in helping these patients not only get healthy, but cosmetic wise and even just functionality to be able to chew and eat dinner. I mean, we take that for granted, right? So what are some of the things that really brought that passion for you for dentistry over the years?
I really think that it's just watching the transformation. Dr. Baird talked about a patient that she was young when she came in, and her teeth were not the best color. She had kept having decay. Every time she would come in, she had more cavities. She was drinking Dr. Peppers. She wasn't didn't have really good home care. And she had a brother who had never ever had a cavity, and it was she was constantly having cavities. And I
Yeah.
remember her coming in and feeling so defeated. And he said to her, "If you had a really nice car, how often would you wash that car?" And she kinda stopped and was like, "Well, I would probably wash it every week." And he
Mm.
said, "And if you had a car that you didn't care for, how often would you wash it?" And she just broke into tears. And, she's 22 years old at the time, I believe. And because she understood what he was talking about. She
Yep.
didn't like her smile, and um she wasn't taking great care of her smile and her teeth, and it was leading her down this path, and her parents were tired and frustrated of spending all this money, and, you know,
Yeah.
he assured her that he could give her a beautiful smile, but we talked about risk factors, and we talked about her decay risk, and her gums were not in the best shape, and so we talked to her about coming in and going through gum therapy and, using Carry-Free.
Doctor, if PPOs have you feeling restricted as a dentist, but you're not sure if going completely out of network is the right move for you, that tells me that you are right at the stage where having a strategy and plan is essential if you want to protect your revenue and grow. Investment Grade Practice, powered by Productive Dentist Academy, is hosting a live event this September that will help you design the right revenue mix for your practice. At Unrestricted, the End of PPO Dependency live, hands-on workshop, you get to work with renowned business and clinical experts who will help you analyze, clarify, design, align, and activate a plan so you don't have to feel restricted by PPOs ever again. Go to investmentgradepractice.com today for more information and to secure your seat. This event is strictly limited, so go to investmentgradepractice.com today.
And really getting off the Cokes and the Dr. Peppers and stuff, because he said, "I can give you a beautiful smile, but I'm not gonna have your parents spend this money if you're
Yep.
not gonna take great care of it." And,
Yep.
she wouldn't hardly look you in the eye. She was very, very soft-spoken, just, struggling.
Yeah.
And the smile transformation that we were able to give her, and her mom and dad both became patients, and, they were just so thankful and appreciative. And I remember her mom coming in with her and saying, crying and just saying, "You've given me my daughter back." Like,
Oh,
it's not just a smile, it's like
yeah.
her personality changed. And, now she's a mom. She has a little one-year-old little, uh, girl, and I'm friends with her on Facebook. I still see her
Yeah.
parents, and, that's special when you can be a part of that. Um,
Mhm. Mhm.
so that's the passion. That's what I strive for, I guess, is giving people back their confidence and just seeing their personalities come back. And
Yeah.
I can just tell you, there's so many stories of, um, there's a guy that was a patient like 8 years ago or something, and we didn't even realize it, but at the time he was, on drugs and alcohol and was really struggling, and he didn't have upper teeth. He just had some anteriors on the lower. And, anyway, we didn't end up doing any treatment on him until probably 2 years ago.
Yeah.
And, that's when he shared with us kinda where he was at when he came in originally. And, man, you ought to see his smile now, and it's just see them getting back into the work field and just being successful, having relationships and children. Dentistry is hard. It's stressful.
Yeah.
Well, it's hard on the body, it's hard on your back and your neck, and, uh,
Mhm. Yeah.
but all of those special stories and transformations make all those aches and pains worth it.
I love that. It really is kind of this unique industry that I don't think we think about as far as really changing lives. You've been an assistant for a really long time. I have to say, I was an assistant 5 years ago. I loved it as well. I still would love to be able to like get in there and assist. I loved it. What are some of those things though? Because I know as well as you do that the doctor comes in, you really have a great relationship with these patients simply for the fact that they spend more time with the hygienist, with the assistants, right? Than they really do with the doctor. So, what are some of those things that patients are saying to you that they're not saying to the doctor?
Well, I think that they are more likely to share some of their fears with me. Initially when they come in as a new patient, we have obviously the medical history and the, simple kind of questions of, are you happy with your smile?
Yeah.
Basic things. But then we ask them like, what made you decide to move forward now? Like, what is it that you want? Do you want function, health, smile? What is it that you really want? And I think they're a little bit more, less afraid maybe
Mm,
to share with
mhm.
me versus the doctor. And I just start to utilize that time and the papers that they filled out to kind of guide that questioning and just really start to ask them, how can we help you?
Yeah.
What does made you make the call? What made you, what brought you in today? And I start talking to them about risk factors, and they kind of start to understand when we go down this path. First of all, that I don't just want to talk about teeth, but I
Yeah.
talk about who they are and what they do for a living. Do they have kids? Do they, I want to find out a personal life too. And they start really early in the appointment, learning that we're different. And,
Yeah.
they're like, "I've never had anybody actually talk to me and get to know me," before they started talking about just my teeth. And, I think that is a simple thing to do, and I say it's simple. I know a lot of dentists have a hard time with that, getting on the personal level. They just wanna, "I'm just here to talk about teeth." But I think when you take the time to get to know someone, it really gives them, you can almost see the relief. It's like,
Ah,
"Oh, this is a different place." And, I let them know what they can expect during the appointment. So, today we're gonna gather information, we're gonna take the CBCT, we're gonna take individual X-rays.
yeah.
Doctor's gonna come in here and talk to you about what your options are, and really, just make recommendations on what you're a candidate for. And then we'll talk about cost and timeline and payment options. So we're gonna try to get all of your questions answered while you're here today. And you can literally go, that they just really go, "Okay, that's exactly what I need." And so then when the doctor comes in, so in other words, I'm just setting the doctor up
Right.
to come in and just be able to sit down and be themselves. And, I think that that does set us apart. And I think that, when people come in for second opinions, sometimes third opinions, I think that that makes a difference in, because they say, I've never been talked to at a dentist office like this. I've
Yeah.
never felt like this at a dentist office. I have a patient, one of my favorite patients that really, um, we did a all on X on him, upper and lower, and he, was a paramedic when he came in, and, he had some really bad gum disease to the point to where, like, his front tooth was loose and he had spacing. Um, I just remember him being very guarded with even opening his mouth. He would barely look me in the eye. Um, and we did a extensive treatment plan on him.
Yep.
And, um, when we got him through it, and then but when we finished his case, he, he looked me dead in the eye, and he said, "I just want you to know that you're the reason why, or you are the way you changed my life." He said, "I had been to several different dental offices before I came to your office, and every time I left, I felt worse about myself." He said, "But
Wow.
when I came into you," he said, "I didn't feel judged. I felt like you really truly wanted to help me." And he said, You are the reason why I came here. You are the reason why I chose to do my work here. and you changed my life." And, you know, I get teary-eyed even thinking about it because I didn't know that like, I just connected with him, and
Right.
met him where he was at, and, so to be a part of that is very special, and,
Yeah.
the dentistry, you asked me earlier what has changed, and I don't think I really answered that, but, um, the digital world has changed everything, like,
Ah,
just completely, and not having to take all these impressions and doing scans and photogrammetry and
yep.
3D printing, and it is, it's a very fun time to be in dentistry because of all the cool technology, and I know there's things out there that I don't even know about, but just the quality of the dentistry and the smiles that we're able to produce, it's very special.
Yeah.
So
Summer, I was thinking back to the days of assisting and, you talked about impressions. I really think there was times we probably like rock, paper, scissors who had to take the impression on the gagger patient, right? Like it's so, but what I love is this technology is now really what's better for the patient. They have a better patient experience because our technology is better. And so dentistry is not what it once was as far as, I think patients speak up a little bit more. I think that dental teams definitely work on our relationships. I think in dentistry now we've seen the importance of taking that time to really form the connections with our patients. The medical field is still, get them in, get them out type thing. But dentistry, we really are starting to slow down now. And I think teams are understanding hey, this is crucially important to our patients, saying yes to their health. One thing that I heard you say that I love is, and we know that Bruce said this all the time, which is we just take great care of our patients. So, you know, in our dental offices, it gets crazy, it gets chaotic, we get behind schedule. How do you slow down, take the time to get to know them, and to ultimately just take great care of the patients?
well, that is, because I have an awesome team around me and supporting me, and, we all are patient focused, and everybody will step in and help, and that gives me the ability to be able to spend the time and not feel too rushed, because I know that I have a great team that supports me and that can get that patient if I'm running behind with this patient because they need extra time, then I reach out to my team and ask for help, and, I know that they're gonna have my back, and
Mhm.
so that's what gives me the ability to be able to stay right there and stay focused on the patient or the task at hand, because we take great care of each other as a team as well.
Yeah.
I think that that's what gives me the ability to stay focused and, stay in the moment with the patient and give them the care that they need, whether it's a clinical like very technical implant screws and things like that,
Yeah. Yeah.
or it's taking x-rays or whatever, and not everybody in the office obviously can do all of this stuff with the hybrids or, everybody has kind of this our specialty kind of things that we do, but they can definitely get them back, get the blood pressure, get them comfortable, get a blanket, get their pillow, in other words, just get them comfortable and set and ready and talk to them and assure them that Summer's gonna be in here in a moment and she's just running a few minutes behind, and but
Yeah.
that way they can get them settled and ready, and I really think if I didn't have the support of a great team, I don't know that I would be able to deliver the same care.
Yeah. I love that. When we talk about our patients and again, you are such a pivotal part of that patient experience. And what what language would you give other dental team members that are listening to this about, what would you say to a patient that's already feeling overwhelmed and maybe as hesitant about the treatment that's been presented before them.
I think that most patients that come in, um, are overwhelmed or they feel overwhelmed.
Yeah.
Y Some of them come in and they've done a lot of research. They may have already had, a treatment plan given. But I think, because of the marketing that we do, we're marketing for big cases pretty much. We are marketing for those people that need the smile transformations. And so pretty much the patients that I see now are not in a good way. They have multiple missing teeth.
Yeah.
They don't have a good happy smile. They are not going to their kids' activities at school because they don't wanna embarrass their children. They Everybody that they work with thinks that they're unhappy, and their spouses think they're unhappy, and they don't wanna go out to eat because they're embarrassed to eat. And so, I think the majority of people in this situation are overwhelmed, and
Yeah.
I think just being able to, give them confidence that you're gonna provide them, like, that we can get you a great smile. We
Yeah.
just have to figure out which direction that we're gonna go, and something that's gonna be able to fit into your lifestyle and your budget. Because bottom line, it does come down to budget.
Yeah.
Um, we don't wanna say that, like, we don't wanna think that, "No, everybody can get financing." Well, that's just not true.
Yeah.
You know?
Yeah.
And so I just wanna kinda figure out where their pain point is,
Yeah.
and, you know, sometimes money is not an issue, but sometimes they need the confidence that we can do this, and I think just
Mhm.
providing them, um, well, I keep saying confidence, but I don't know, I mean, that's really what it is. It's confidence
Yeah.
we can provide the smile, confidence that we have can get great results. You're
Yeah.
be able to bite into an apple again. You're gonna be able to eat a steak again. I have so many patients that their diet has changed.
Right.
Not only does that affect them, for many different reasons, but it affects their health because
Right.
digestion is different. The types of foods that they're able to eat has changed. So it really truly affects their overall health.
Yeah.
My dad is about to go through a transformation, and we've been working on him for, well, as long as I've been here, 28 years. We've been working to try to fight to keep his teeth, and it's to a point to where we've lost the battle and we've got to do something different. And it's been a quite a journey walking my dad down this path. And obviously he's nervous. He's eh, you know anyway, so it doesn't matter to me if it's my dad or somebody I've never met before. I just really want to let them know that we've got you. We've got the we've got a great team. You're going to be in good hands, and you're going to feel like you're going to be part of our family, and we're going to take great care of you.
Yeah. I mean, I can just feel your compassion, and obviously I know you on a personal level because we've, been at many events together, and I know how compassionate and caring you are, but I love that even every patient that comes through feels that. You I When you spoke to not every patient can qualify for financing. Right now, I am hearing that so much in the industry about, when gas prices are expensive and food is expensive and all these different things that really affects our patients. It's not that they don't value the treatment, but sometimes those finances are very overwhelming, very scary, or they simply just cannot afford it. So, what would you say to those practices that are feeling that right now of we're having a harder time helping our patients because they simply, you know, are having a harder time being able to afford it? What's your recommendation, Summer?
Well, I remember one day I had been in there with a new patient, and Dr. Baird said, "Well, what's their budget?" And I was like, "I don't know what their budget is?" And
Yeah.
he's like, "Go in there and ask them." And I was like, "I cannot do that." And he's like, "Well, no, I need to know. Just go in there and ask them what their budget is." And I was like, "Dr. Baird, that's like asking somebody, like, how much money do you have in your checking account? Like,
Yeah.
I might as well ask them, I don't know." Anyway, so, um, it felt uncomfortable,
Mhm.
but then when I did, he was able to provide them a treatment plan that was going to fit into their budget
Right.
versus talking about something fantastic that they would never be able to have.
Right.
And so, I do that a lot now, and it gets easier. I was
Yeah.
when you start talking about treatment plan, when your treatment plan presentation, the financial conversation from the back, scheduling from the back, all that stuff can be scary, if you're not currently doing it. But
Mhm.
what I feel is these patients feel more comfortable talking to me about this because I'm the one that greeted them,
Yeah.
gotten checked in. I've walked them through, I've already gotten to know them. I've already calmed them down a little bit. I've been in there listening to the doctor do the treatment plan. And then when we go into the financial conversation and the scheduling and everything, it's like they feel comfortable with me. And um anyway, I think that it's not as comfortable to be able to do that, but, when you're not doing it, it's easier just to hand that off, but I think that the patients feel more comfortable because I'm the one that's created that conversation with them and made them feel that way,
Yeah.
but asking the budget question, it really does help because, I mean, let's just say they need to have just, crowns and fillings and stuff like that, like, they have some decay, but they can't afford $10,000 worth of fillings and crowns. Well, what are
Yeah.
you gonna do? Are you gonna do 1 quadrant, because that's all they can afford, and then 3 years later, all those other teeth are bombed out and they're having to be extracted? Well, why not just do all the buildups in their mouth and
Yeah.
arrest the decay, counsel them on what got them there, talk about risk factors, provide them with a way, an avenue of how to treat those risk factors, nutritional counseling, what got them here, slow down the decay, and then do the crowns 1 quadrant a year if you have to. You're still gonna get them where they need to be, but at least you were compassionate enough to work with them and work with their budget because bottom line, people's gotta feed their families, and they've gotta be
Right.
able to have cars and houses, and they've gotta pay their bills, and so if they
Yeah.
only have, you know, $300, well, what are you gonna do with $300? You gonna charge them for your exam and X-rays? Or are you gonna provide them with some carry-free and nutritional counseling and get them in and get their gums cleaned up?
Mhm.
You really just have to put yourself in their shoes, and
Mhm.
that's really how we treat people, like, when Dr. Baird or Dr. Buski go in and talk to patients, they talk to them as if they were their family, and
Yeah.
what I would do if it was me, this is what I would do if you were my mom or my sister,
Yeah.
and, you know and we do talk about ideal treatment just so they know it is out there, but if you can't afford $50,000 worth of implants, then let's talk about the next best thing. Let's talk
Right.
what will fit in your budget because financially, it's gotta make sense.
Yep. You said the word compassion, and I love that because when you come from a place of compassion around financial conversations, I know so many team members, they're like, I don't like talking about it. It makes me uncomfortable. But when you come from a place of compassion, the reality is that yes, the doctor, the team, you all need to be paid, right? As much as we'd love to do everything for free, we can't. But when you come from a place of compassion, now you take that patient away from feeling shameful or embarrassed that maybe they don't have the financial means, but you're also now putting their health first, saying, we have other options, right? This is best case scenario. We understand you're not at that place. So, what can we do to get you healthy? Because ultimately, our goal is to take really great care of you. I love just that compassion, that teams can offer. So, Summer, what would you tell other assistants who underestimate how important their role really is to not only the practice, but the patients?
You know, I feel sometimes like the dental assistants have the, hard job.
Yep.
You know, I mean, I know all the roles are very important. I follow a bunch of dental assistant pages, and I see that most all dental assistants feel underpaid and underappreciated. Um, I just think that I don't even really worry about my pay. I mean, yes, I need to get paid. Yes, and obviously, but
Yeah.
I just don't focus on that. I focus on what I'm there to do and what I can do to make the patients have a better outcome, on what I can do to help my team, to train my team, to, yes, it's hard. I don't know what else to say. I mean,
Mm.
we all the assistants know that,
Yep.
but I think you should just focus on the good that you're able to do, focus on treating people how you would want to be treated,
Mm.
because it's easy to say, "I'm busy, I haven't had a lunch, I," but what about the rest of the team? And if I do get a lunch, then maybe I should go check in with everybody else and make sure that everybody else can get a lunch, and what can I in other words, it's like, what can I do to help you so
Yeah.
that we can all have a break? Um, uh, I focus a lot on my team, and, like I say, I count on them, they take care of me, but I also try to take care of them too, and,
Exactly.
um, we all wanna go home at the end of the day, we all have our own lives, and, but we just have fun, we laugh.
Yeah.
We laugh
Yeah.
a lot. Our patients are like, "My gosh, when I come in here, y'all just seem like you're so happy and everybody's having fun," and it's like so we try to focus a lot on that. We play hard and work hard.
Mhm. Yep. Summer, this was such a powerful conversation with you today because it reminds us that dentistry is never just clinical. Patients walk into our practices needing crowns and implants. And I mean, you even spoke to really full smile transformations, but underneath all of that, they are really coming with fear and embarrassment, uncertainty, and years of emotional trauma that's tied to their smile. And what I love about your perspective is the reminder that trust is always built in those small moments. The conversation after the doctor leaves the room, the tone, the feeling that someone is actually listening to them and walking beside them through the process. You are a true patient advocate. And for every dental team that's listening to this episode, it's a reminder that treatment acceptance is not just about explaining the procedures better, but it's actually about helping patients feel safe enough to say yes and move forward with something that feels really big in their life. So, Summer, thank you so much for being here, sharing your heart, your experience, and your perspective with us today. You know, I love you so much, and I really appreciate you being here.
Thank you, and I just wanted to say one quick other
Yes.
story about
Yes.
this patient that came in recently, and,
Yes.
he's come in as a new patient. He's had, I guess, 2 appointments, like, one for his consultation, one for his records. His surgery's scheduled on Monday, and so, he's been seeing an assistant named Taylor, and she's gonna be out on Monday for her son's, something at school. And, anyway, so I called him to talk to him about his surgery, and I said, "But Taylor's not gonna be here, and I just wanted to review a few things with you." And he goes, "Well, I'm not coming in if Taylor's not gonna be there." And I was like, "No, no, we're gonna take great care of you." I said, "Shannon and I are gonna be here to take great care of you. We've both worked with Dr. Buski for over 20 years.
Yeah.
We're gonna take great care of you." And he goes, "Oh, man, so you mean I gotta come in there and a couple of old broads are gonna take care of" So, anyway, so we had a great conversation on the phone, and, um, I told him, I said, "Oh, we're gonna have fun with you on Monday morning."
Is that
After
this coming Monday, or did you see
Yeah.
him already?
Oh, no, no, yeah, this coming
This
Monday is
coming Monday.
and
Oh
so
my gosh.
so Shannon and I have already planned on Monday morning, we're gonna go out there and tell him the old broads are here to
I
back.
That's what I was gonna say. Yeah, create some name tags that says old broad on it. Hey, we're here to have fun.
Yeah,
I love that. But again, it's not about the dentistry, right? It's about that relationship that the patient has with Taylor. And then I love how you were able to pivot and have fun with him when he called you an old broad.
yeah, yeah, so, but he said, "I trust y'all, everything all the experiences I've had from the coming in the office, from calling the office,
Yeah.
from visiting with Taylor, the doctor," he's like, "I feel 100% confident, and if you say you're gonna take great care of me, I trust you." You know, we really haven't done anything on him except for scan records and impressions and scans and digital scan, all those kind of things,
Yep.
but as far as the dentistry hasn't even begun,
Yeah.
and he's already singing our praises, and so, I feel like that's why I do this every day. That's why I've been
Yes.
doing it so long. People are like, "How long are you gonna be doing this?" And I'm like, "I'm gonna be doing it as long as I can, I guess." I mean, I can't imagine doing anything else. I feel like I was blessed to come into dentistry. It happened purely by accident, and I can't imagine doing anything else. So, thank you for having me and spending
You're
time
welcome.
with me and you know, just visiting and having a good conversation. So,
Summer, always. You are a fan favorite, and a favorite amongst many in the dental industry. You have helped guide so many dental assistants through your knowledge and experience. So thank you for all that you do as well. I adore you. Welcome back anytime.
all right, thank you.
Thanks, everyone.
Hey, thanks for joining us on Everyday Practices Dental Podcast. It would mean the world to me if you could leave us a like or a review on iTunes, or go to Productive Dentist Academy through Google and leave us a review there. We are here each week to talk about what's possible when you leave your practice with clarity and courage. If you are ready to build a business that supports your life and not the other way around, investment grade practice coaching powered by Productive Dentist Academy can help. Visit investmentgradepractice.com to schedule your free 60-minute coaching session so you can start designing the practice and lifestyle you've been dreaming about all along.